through the introductions to the different types of research that you can do. So you have your narrative review, you have your systematic review, and you have meta-analysis, which is something that's quantitative and adds on to your systematic review. And now we'll be moving on to the specifics of how to write a systematic review. So we have made like a step-by-step process in how to make a systematic review. So as you can see here, there are 5 steps in general, and that's to build a protocol for your systematic review. Protocol is the very first thing that you're going to do. So part 1 is building your research question. So what's your hypothesis? What do you want to answer? Establishing inclusion and exclusion criteria. So again, this is what kind of studies you're going to include and what kind of studies you think is not relevant for your research question. And then your search strategy. So that is composing the kind of keywords that you're going to put into your database. We'll go through this one by one, no worries. And then the assessment of bias and your protocol registration. Right, so first step is building research question. And so this is like a recap. We've gone through this last time, but we'll just go through it again. Components of a well-constructed research question. You have your population, your intervention and exposure, and your comparison and your outcome. Sometimes you can have time and setting, but most times people don't usually have that. So population, for example, would be a patient with cancer. Intervention would be the drugs. Comparison, you could say, with no drugs or a placebo. So if someone said they can't see my screen share, can all of you guys not see the screen share? Is it only Baba that can't see it, or? Okay, so everyone can see it except Baba. Baba, you can't see the slides that I'm sharing at the moment? I think most... Okay, maybe you can join on a different device?
Or maybe I should use a computer.
Maybe, but it works on my phone. I've joined on my phone as well. Do you want to try disconnecting and coming back? Maybe that'll work.
Alright, thank you. Yeah, I'll do that.
Okay. Hopefully that works for him. Okay, he's back. Right, can you see the screen now?
Yes, thank you.
Okay, great. Alright, so components of a well-constructed research question. We were going through the PICO method, PICO usually. So again, population would be, for example, a patient with cancer. Your intervention would be your drugs. Your comparison would be like a placebo. So placebo is pretty much kind of something that you give them, but it's not supposed to have any effect on the disease. And the outcome would be, did the cancer progress? Was it taken out or no? Or did it get worse? So that would be outcome. Now for timing, this would be something like if you want to see if giving a drug would be more effective when you give it during the day or during the night, because sometimes that makes a difference. And setting would be something like if I want to look at the efficacy of a certain drug in these patients in Australia, for example. So that would be like the place, like a setting. Okay, so here we go through one by one. Types of population. You have population and settling of interest. Definition of disease, so like cancer, what kind of cancer specifically. And then defining the population, so definition of disease. Describe the participants. Define the relevance of demography. Define the setting and reason for exclusion. Okay. We will have an example of this, of a mock review in the end, so we'll go through it all, don't worry. Okay, and then types of exposure and intervention. So timing, again, maybe giving a drug in the day will be better at night, something like that. Dose intensity, finding the right amount of dose. Routes of administration, so that would be like Is it better through IV injection? Is it better orally? And then duration or any other relevant details about intervention. Right? So, refining your intervention, you need to define the experimental aspects of the studies and the control. Delve into the variations of the intervention based on dosage intensity, mode of delivery, personnel who deliver it, frequency of delivery, and define the variations relevant to the review. And you have to define the inclusion and exclusion such that the studies that differ slightly from the intervention or include parts of it are explored and the exact inclusion or exclusion is determined. So that's a very, very long paragraph. But basically, for example, if you want to try a new drug, right, you need to be very, very specific in what kind of studies you want to include. So let's say I only want to look at drug A in 2 milligrams orally once daily so this would be like very, very specific, delivered by nurses, for example. Now that would be that could be covering the variation. So if this drug is, let's say, administered at 300 milligrams instead of 200 milligrams, you can choose to exclude that because it's not the same. So that's like variations. And then what they mean when they say studies that differ slightly from the intervention, so that's what I gave the example of, for example, just a different dose, or includes parts of it or combined with another intervention. So for example, in some studies that hospitals output, they could be saying, oh, we're investigating drug A in combination with drug B, or we're investigating drug A in combination with drug B and comparing it to drug A with paracetamol. Then that would be like a combination and it's not alone. So then you need to also decide whether or not you want to include that or you want to exclude that. That's another thing that you need to refine for intervention. And then you have your types of comparison groups. You have your placebo. So again, this is giving a drug that is not supposed to have an effect on the disease. Not really a drug per se. Sometimes it's a sugar pill. And then you have your standard and contemporary more permanent therapy. So this is like kind of like the standard in today's world. And the reason why you're doing the systematic review is to see if maybe there's a better drug than what people are using these days. And that's why systematic reviews are important. Or no treatment at all. This is especially the case for new diseases. Although for COVID, if you remember correctly, most of them use placebo. Okay, and you have your types of outcomes. You need to define your stakeholders. So stakeholders impact outcome. For example, lab values are relevant to doctors, efficacy of drug is relevant to pharmacological departments, and time for recovery is relevant to the patients. So you need to define these as well, because sometimes in a study, they tell you, oh, in follow-up, this cancer did not progress, so therefore that is good. But maybe a patient, they're more worried about, oh, will I need to keep taking these drugs for the rest of my life? You know, it's more quality of life. So there are these outcomes as well that may be more important to them. So these are, again, things that you want to look at. Okay, so refining the outcomes. The ultimate outcomes for inclusion in summary should be essential for decision making, as per the stakeholders identified. Multiple stakeholders can connote to multiple outcomes. The best outcomes cover reality, potential, and adverse effects and or potential disadvantages. So what this means is, in reality, for example, say this drug, it slows down the cancer progression. And the potential would be, does it have potential to minimize the cancer cells and kill them? Can the drug do that? And adverse effects may be nausea and vomiting, or dizziness, or weight loss. So these are things that you want to look at as well. And so you have to kind of choose what you think is most important for your research question, and then you'll do your protocol, and you need to stick to your protocol to the T. Okay. So building a research question, you have your incidence. So what percentage of people from the population were diagnosed with the problem each year? And you have your prevalence, what percentage of the population currently living or suffering with the problem. So these two incidence and prevalence, a lot of people kind of mix them up. But incidence, you can just think of something that's new. So when you think of the word incident, right, it's an accident. It's kind of like, it's not from the past, it's kind of new in a way. Maybe that'll help you remember it better, because that's how I remember it. So incidence rate would be the new, like how many people have been diagnosed. So that's like the new one. And prevalence is overall, like at the current moment, not just the ones that are new. So they're the ones currently living or suffering with. So let's say if someone is diagnosed 5 years ago, you would count them in for prevalence because they still have the disease. But for incidence, let's say they were diagnosed in 2021, but you want to look at the incidence in 2024. So then you don't count them in because they were diagnosed a while ago and not now. Okay, and then you have your therapy. So what should be pursued to treat this problem? So this is like kind of like the intervention part. You have your screening. So how does screening this problem early pose a significant advantage to the patient or healthcare provider? This is not a research question that you can explore. So I think a lot of the programs in the UK, we have a lot of screening programs. We have breast screening. We have, I think, their prostate specific antigen as well, which they check once you reach a certain age every 3 years. Because it's been proven through systematic review and meta-analysis that if you screen early, you can catch the problem early and patients will have better outcome because of that. So this is very clinically relevant. And then you have your diagnostic accuracy. So how good is the screening or diagnostic method at detecting this problem? So again, this is similar to this, except this is more about how accurate something is. Okay, and then you have your prognosis. So what are the likely outcomes of the problem? And your harm. So prognosis is pretty much what kind of outcome the patient will have in the future because of the disease. And in harm, what are the side effects associated with the intervention in consideration? Etiology, what are the likely causes of the problem? And prevention, how can the problem be addressed from a prevention standpoint? So that's like so you can also do a study where you kind of identify what kind of characteristics are a risk factor for a disease, for example, and what can be done to minimize that. So that would kind of be prevention. Okay, so now we've learned how to build a research question. There are the different types of questions, and if you look at your mock review document, so I'll just pen over here, you'll see this document which very nicely gives you examples, so you can run through one by one. Right, so these are the types of possible research questions. So for incidence, for example, you wanna we're going to use diabetes as an example for all of these because I think it's a disease that we all know about and it's quite easy to follow. So again, for incidence, you look at your population. So among adults aged 40 to 60 diagnosed with type 2 diabetes. And then the outcome would be annual percentage of new, so incidence is new, type 2 diabetes diagnosis. Time frame, for example, you can do over the last decade. And intervention, there would be none because you're not really doing anything. You're just seeing how many people have been newly diagnosed with the disease, and of course, no comparison as well. Right. Checking if, okay, so there are no questions so far. Right. So the question that you would make would be, in adults aged 40 to 60 diagnosed with type 2 diabetes over the past decade, what is the annual percentage of new diagnosis? So it's pretty straightforward for incidence. Right. Now for prevalence, the population, for example, urban and rural populations in India. Intervention, well, there's not really an intervention since, again, you're just looking at how many people are currently living with the disease. And for comparison, you'll be comparing urban and rural areas. And then for the outcome, you would get the current prevalence rate of type 2 diabetes. Now for prevalence, that is at this current moment. So your question would look like this. Among urban and rural populations in India, what is the current prevalence rate of type 2 diabetes? Pretty straightforward so far. Okay, so now we're looking at the therapy. This is the one where most people would do systematic review and meta-analysis on, because it helps you find out, what's the better way to treat a certain disease, and that's what we usually hone in towards as medical students and doctors. So here, again, PICO, your population, would be patients with type 2 diabetes. Intervention, for example, dietary interventions, let's say a certain type of diet, and you compare with some other dietary approaches. These can be anything. It's very much up to you. You can do the intervention as a drug, for example, a new drug, and you can compare it with the old drug, like metformin, which is what most people use at this day and age. And the outcome, for example, would be reduction in HbA1c levels over 6 months. So your time frame would be 6 months. Pretty straightforward again. This one, for the outcomes, it doesn't necessarily need to be HbA1c. As you can see, some people may choose to use, fasting glucose level, or they may choose to do an oral glucose tolerance over like 2 hours, So that's very much depending on, after you do the search, what do you think you want to look at and what sort of question you want to come up with. So if this is what you're looking at, your question would be, in patients with type 2 diabetes, which dietary intervention demonstrates the most promising results in reducing HbA1c levels over 6 months? So again, this is I would say the most relevant one. Most people do these kind of systematic review. Okay, and then you have your screening, so population, high-risk individuals for pre-diabetes, for example, and then your intervention would be early screening for pre-diabetes, comparison with no screening or late screening, pretty straightforward, and outcome, long-term cardiovascular risk. So your question would be, for high-risk individuals, again over here, your population, how does early screening for pre-diabetes affect long-term cardiovascular risk compared to those without screening or with delayed screening? So this PICO framework is actually really, really good. It makes things so much easier and more streamlined. And lastly, we have our diagnostic accuracy. So population, again, individuals being tested for type 2 diabetes, intervention, fasting plasma glucose test, comparison oral glucose tolerance test, outcome, sensitivity and specificity, not specified, and in individuals tested for type 2 diabetes, what is the sensitivity and specificity of the fasting plasma glucose test compared to the oral glucose tolerance test? So hopefully with these examples, it'll help you wrap your head around kind of what different types of research questions are and how you can go about writing it. And you all have access to this, so you can have a look at it in your own time, and if you have any questions, you can let me know. So again, this is just all of them in one short paragraph. So these are the different types of questions for the same disease. What is the annual percentage of new type 2 diabetes diagnosis within the adult population aged 40 to 60 in the last decade? That would be incidence. And the prevalence would be the current prevalence rate of type 2 diabetes among urban versus rural populations in India. Now the therapy, which dietary intervention shows the most promising results in reducing HbA1c levels in patients with type 2 diabetes over 6 months? Screening, again, early screening for pre-diabetes, how does it affect long-term CV risk in high-risk population? Diagnostic accuracy, you'll be looking at sensitivity and specificity of the two different tests, so fasting plasma glucose test in this example compared to our glucose tolerance test. And prognosis, Now, this is looking into the future. So, what are the long-term cardiovascular complications associated with uncontrolled blood sugar levels in type 2 diabetes patients over the 10 years? So, prognosis is kind of like looking at certain parameters or characteristics of a patient that they have at this point in time, and you can associate it with their potential outcomes in the future and how it looks. So a good prognosis, for example, would be, oh, their blood sugar level is controlled better. And a bad prognosis would be, it's not. So in this example, right, what are the long-term cardiovascular complications associated with uncontrolled blood sugar levels in type 2 diabetes patients over 10 years? So if we say uncontrolled blood sugar levels, that would be like the characteristic that the patient has, and this could be a factor for a bad prognosis. So a bad prognosis, for example, would be having long-term cardiovascular complications. So that's what it means. And then harm, what are the adverse effects of prolonged use of a specific medication, so for example metformin, for managing type 2 diabetes in elderly patients? So these are looking at what the adverse effects are. And then etiology, what are the potential genetic and environmental factors contributing to the increased incidence of type 2 diabetes among certain ethnic groups in India? Now, this one is kind of a little bit of epidemiology, kind of more incidence, statistic rates, and yeah, kind of epigenetic stuff as well over here. So these factors, yeah. And in your prevention, how effective is a structured community-based exercise program in preventing the onset of type 2 diabetes among high-risk individuals with a family history of the disease? So they're looking at an intervention here. Structured community-based exercise program. That's your intervention. Okay, so I see that we have a few questions. I'm going to have a look at them first. So Hema, so a study has to answer all these questions using the PICO protocol, or it could be about a single question out of those. Right. Has to answer all these questions using the PICO protocol. The first part, not necessarily, or it could be about a single question. I'm not sure what you mean with the second part. If you can explain that to me, you can type it out and then I'll have a look. Just type it in the chat. If you can rephrase the second part of your question. But for your first question, you don't necessarily need to answer all of the PICO, because as you can see here, I'm just going to roll up here. If your question is about incidence, you won't really have intervention and comparison because you're not intervening the patient themselves. Intervening would be giving them treatment plans, because that would intervene with the progression of their disease. So incidence, it'll just be looking at new diagnosis. It's just statistic, kind of like how common it is in a way, but it's an incidence and it's not doing any drugs or surgery or anything like that. So you won't have intervention in comparison. So it depends on the type of research question that you have. But if your question is about a new drug, oh, is this new drug effective for this disease? Then you definitely have to answer all of PICA. So a new drug, say drug A, right? Your intervention would be drug A. Comparison with the old drug, placebo, so that has to be answered. And your population, drug in who, for what disease? You have to put it in population. And the outcomes, how do you know which drug is better? What are you going to compare them on? So are you going to compare their HbA1c level over 6 months? Are you going to compare their safety? If you're comparing safety, then you're going to look at their adverse events. So does drug A have less side effects compared to drug B? So you would have to answer all of PICO if you're looking at therapy. I hope that answers your question. You can let me know if it doesn't, and you can ask more questions for sure. Okay, so like maybe a study just talks about, let's say, a therapy, or it has to have all parameters like incident. Oh, no. A study, it's usually just one of these types, right? So these are all the different types. So if you have one study, they will be either type 1 or type 2 or type 3 or type 4 or type 5. They're not all together in one. No. It's much more simpler than that. I think you're thinking way more complicated than it is. Yeah, nice. Okay, I'm glad you got it now. Okay, no worries. Sri is asking, prevalence would be the percentage of population diagnosed with the problem each year. No. So the prevalence is not. So when you say newly diagnosed, and when you say diagnosed, right? It's new. They just got it. Let's say patients with type 2 diabetes in 2024 in the world. Okay. If you're looking at prevalence, then it needs to be everyone with type 2 diabetes in 2024 only in the whole world right now at this current moment. Anyone with that disease, you count them in. That's prevalence. And then with incidence, that would be everyone in the world got diagnosed. They just found out that they have type 2 diabetes this year in 2024. Now that would be incidence. They just found out. So if, let's say someone, for example, I have been having type 2 diabetes since 2015. So I would be counted for the prevalence rate in 2024 because it's now 2024 and I do have type 2 diabetes now. So I would be counted in prevalence, but I would not be counted for incidence because I was diagnosed in 2015. I was not diagnosed now, so I'm not new. I hope that answers your question. What's when it is indirectly? Is it indirectly not meaning? Yeah, I hope that answers your question, Sri. Oh, great! I'm glad you understand that now. Prevalence is the number of population currently living with it. Exactly. Perfect. Exactly that. So, why therapy 1 is more common for systematic review? That's a very good question. So, therapy 1 is more common with systematic review because that is how you treat a patient. So, if a patient comes into the hospital and they're like, doc, I'm not feeling so good, blah, blah, blah. And then you find out, oh, they have type 2 diabetes. How am I going to treat them? How am I going to make them feel better? You have to choose the drug that is best for them. And that would be what therapy is. Which drug is better? So as you can see here in this example, which dietary intervention demonstrates the most promising results? So these systematic review, they would tell you what would be the best. And so they can change guidelines and doctors would know, oh, this drug is better, so I want to give my patient this drug because it's been proven in this review, which is what the guideline is based on, that this drug is better. And that's why therapy is more commonly used. Whereas incidence, for example, and prevalence, you kind of know how common a disease is, but it's not kind of directly related when you're looking after a patient. You're not going up to them and be like, oh yeah, you have type 2 diabetes, but did you know that 90% of the world is diagnosed with diabetes, for example? It's not really relevant to the consultation itself in a way, if that makes sense. So this is kind of like to give you statistics, right? But this is directly to the patient care. And so I hope that answers your question as well. And that's the same for screening and diagnostic accuracy. And now people are actually shifting more to screening and diagnostic accuracy because you can catch the disease quickly, so you can treat it more early. And they have better outcomes as well. Yeah. So I hope that answers your question. Okay, so that was for the types of research question, and now we're moving on to the different types of studies. So for incidence and prevalence questions, you would want to look at surveys and cohort studies. for therapy, you would want to look at clinical trials. So like if you want to look if drug A or drug B is better for diabetes, then clinical trials are what the hospitals do. So when a hospital does a clinical trial, for example, they want to test drug A, they could give 100 patients drug A, they could give 100 patients drug B, so the old drug, and then they'll compare it. So then when you do a therapy question type of systematic review, you're going to want to look at these clinical trials and see and compare the outcomes in this hospital, that hospital, and many hospitals, and distill it into one very nice systematic review in a concise manner. And the same goes for screening. So when does screening derive a better outcome for patients? So that's also clinical trials, and same goes for diagnostic accuracy. You have clinical trials and cross-sectional studies. I think we have the definitions of these studies in the mock review later on, so we can move on to there after this. So prognosis, again, clinical trials and cohort studies. Harm, clinical trials as well, because you give the patient the drug and you see how they respond to it. Cohort studies and case control studies. And etiology, cohort studies and case control. Okay, so let's see here. We should have the definitions. Great. So you have them here. So types of studies, these are the 5 big types of studies you would normally find for your systematic review. So your first type is your surveys. And the definition, these involve collecting information from a sample of individuals to understand their behaviors, beliefs, or conditions. So, for example, a survey might gather data on the dietary habits and exercise routines of individuals with type 2 diabetes. Pretty simple. I think most of us do this in our high school projects. We send out surveys and get people to respond to them. And now cohort trials. These studies follow a group of individuals over time to observe the development of certain outcomes. For example, a cohort trial could track individuals with type 2 diabetes adhering to a low-carb diet and monitor their HbA1c levels over a year. So pretty straightforward. If you give them a certain type of diet, how do they respond over time? So that's your cohort trials, because it's a cohort of people, a group of people that you're following. And then clinical trials. Clinical trials involve testing interventions or treatments on participants to evaluate their efficacy and safety. So for example, a clinical trial might assess the impact of a Mediterranean diet on weight management in individuals with type 2 diabetes. So weight management, that would be your outcome, and that's to test the efficacy. Oops, there you go. And this would be your intervention, your Mediterranean diet. Okay, and then you have your cross-sectional studies. So these studies analyze data collected at a specific time point from a population or subgroup to understand relationships between variables. So a cross-sectional study might examine the association between vegetarian diets and insulin sensitivity in a sample of individuals with type 2 diabetes. So a cross-sectional study, it's more about associations. They're trying to figure out, if you do this, would you have this? So in this example, if you have vegetarian diet, would you have better insulin sensitivity if you have type 2 diabetes? So that would be a cross-sectional study. It's more about associations. Now, case control studies compare individuals with a particular condition, so cases, to those without the conditions, so control, that's why it's called case control, analyzing past exposures to determine potential causes or associations. So again, these are also association, but it's more about kind of risk factors in a way. So here, a case control study might investigate the association between the use of a specific medication and the development of diabetic complications by comparing patients with and without complications who have been on the medication. So, case control in this example, they want to see if this medicine might be associated with a complication. So how do you know if a medicine is associated with a complication? You take a sample of everyone who has taken this medication, and then you compare it. Do they have complications? And how many numbers do not have the complications? That would be case control. Right. So if we just summarize what we have here. So a survey, again, is just giving out a survey, getting to know their dietary habits and exercise routines. It's pretty qualitative. In our cohort trial, this would be following a certain group of patients over time. Clinical trials would be seeing if a new drug, a new intervention, a new method approach of surgery is safe or effective. Now, cross-sectional studies, this would be trying to determine if a certain characteristic is associated with a parameter of the disease. So type 2 diabetes, insulin sensitivity. Is that associated with vegetarian diets? And then case control studies, it would be if you have a medicine, is it associated with the development of complications? So you look at people with the disease, so your cases, with the complications, so your cases, and without the complications, so your controls. Okay, so that's all 5 types of study that we've covered. Again, if you have any questions, please pop them in the chat. I'm keeping an eye on it. So how do you differentiate between a cohort study and a clinical trial? Is your cohort is also testing the outcome of an intervention? That is a very good question. So for cohort, they don't really have a comparison. So if you can see here, a cohort trial could track individuals with type 2 diabetes adhering to a low-carb diet. So your intervention is a low-carb diet, and then you just follow them up, monitor them over a year, but there's no comparison. What are you comparing it with? Is there a placebo? No, they don't have it, because they're just following a certain group of people, so a cohort, over time. And that's what cohort trial is. Clinical trial, on the other hand, they would have like 2 groups. They don't, in this example, it says Mediterranean diet, but in clinical trials, a good one, they would have like a comparison. So if you want to look at, for example, let's use the same low-carb diet in here for clinical trial, they would compare it with like a normal diet instead of a low-carb diet, and then you see that and then you evaluate whether or not it's effective. So that's a clinical trial. They would usually have a comparison. So that's kind of like the main difference, and I hope that answers your question. So the only difference is having a reference point to compare it with. That, yes, it's like that. That's kind of like that's the main thing. But then also another point, clinical trials, they don't really do it like, because this one they say like over a year. So the follow-up is the main part of the cohort trial, whereas for clinical trial, it's not really like, that's not the main part, because as you can see here in the example here also, monitor their HbA1c levels over a year, because they want to see like the outcome over time, so the development. But then for a clinical trial, that's not the main thing that they stress on. The timing is not the main thing that they stress on, unless the timing is the intervention of the clinical trial. So yeah, as you can see here, timing is not the biggest thing in clinical trials. Yeah. So a clinical trial would be like, oh, drug A, drug B in the hospital, this is what we treat them with. And before they discharge, this is the result. And then if they want to look at the future, so following up on them, the title of the clinical trial, it would be saying like, after 6 months of follow-up, that's what they would say for the clinical trial. Whereas for a cohort trial, it's kind of like a given that you're going to follow them over time. So yeah, I hope that answers your question. Is a cohort study and observational study the same? It's very similar, yeah. Yeah. I would say, that, yes, it's very similar in a way where they're both prospective, so going from now into the future. But observational, I don't think you intervene, in observational. You're just observing it. Whereas for cohort trial, you're purposely, adhering them to this diet, and you see over time. So if I remember correctly, the surgeon told me that he knew a surgical oncologist who he pretty much takes out cancer surgically, and then he looked at like 100 scans of patients. He looked at 100 scans of patients, and then he noticed, oh, there's this similarity between all of these scans of the patients. Now that's an observational study as well. So observational study, in a way, it's not as robust as a cohort trial. People would definitely prefer relying on cohort trial or clinical trial compared to observational studies, because observational studies in the world itself, it's observation. So I hope that answered your question as well. But even if you do a clinical trial, I am sure they must be having some sort of checking intermittently, right? Yeah, so they would have the follow-up. So they would have like the 2-month follow-up, 6 months follow-up, 1 year follow-up. But the thing is, sometimes clinical trials don't have follow-ups as well. Yeah. So the follow-up would be, they would have follow-up, but sometimes they don't as well. Or is it like whatever happens during the treatment protocol doesn't matter much, or isn't looked at, and whatever happens during the treatment protocol isn't looked at, and the final result is the only goal? If I understand your question correctly, okay, I think the easiest example would be to give a surgery example. Yeah. So if they take out like cancer, you would want to follow them up to see if they've progressed well from it. Whereas, let's say, if someone came into the emergency department and they had like a kind of more of a limiting disease, sort of, it's not really long term. Can you actually rephrase that? I'm really sorry. I'm not sure if I'm understanding your question correctly. I'm sorry, it's just something that always confuses me. It's okay, you can move on to complete the topic. Okay. You can text me on WhatsApp for your question previously. I'm sorry, I didn't really understand your question. If you could rephrase it, and then you can text it to me on WhatsApp, and then we can discuss it after this lecture. Okay, so moving on. Right, so 5 aspects of outcomes. We have our domain. So the domain refers to the broad construct or area of interest that the outcome aims to measure. It defines the overarching aspect of the phenomenon under investigation. Right. So you have your specific measurement involving identifying the precise variables or parameters used to quantify the chosen domain. In the context of the diabetes medication example, specific measurements might include hemoglobin A1C levels, blood pressure readings, lipid profiles, or patient-reported outcomes such as health-related quality of life questionnaire. And you have your method of aggregation, which is the measurement or data points that will be combined to form a summary measure or result. This step is crucial for synthesizing data across multiple studies in a systematic review or for summarizing outcomes within a single study. Aggregation could include simple means, weighted averages, effect sizes, or other statistical approaches depending on the nature of the data and the research question. So again, there's all of these different studies that you have from different hospitals, and you need to find a way to aggregate and sum all of it up to make one nice review. You have your time frames, so the specific periods during which the outcomes will be assessed or measured. So this is what we've talked a lot about just now with the cohort studies and clinical trials. So like, is it 6 months? Is it 2 weeks? Researchers need to define the duration of the study and the intervals at which the outcomes will be evaluated. For instance, in a clinical trials, outcomes may be assessed at specific time points. So this is the follow-up that I mean, such as weeks, months, or years after the intervention. Time frames provide context and help capture changes or trends over the course of the study. Okay. And then you have your units of measurement. This is the most straightforward one. So for example, if you use blood pressure, then you need to make sure that it's an mmHg. And if different studies use different units, then you need to use you need to convert it into one consistent one that you will use throughout your review. So there ensures consistency and accuracy. Okay. So for outcomes, I think we also have something on the mock review. Yeah. So, okay, this is for later. So the effectiveness of different dietary interventions in managing type 2 diabetes is systematic review. So this is pretty much summarizing what we've discussed previously. So type 2 diabetes, which dietary intervention, most promising results. Okay. Now, moving on to inclusion and exclusion criteria. Okay, I'm also aware we're short of time, but this one is fairly short. So, what is inclusion criteria? Inclusion criteria outlines the specific characteristics that studies must possess to be eligible for inclusion in the systematic review. These criteria are determined based on the research question and aims. Inclusion criteria help narrow down the focus of systematic review by identifying studies that meet specific predefined criteria. This ensures that the included studies are comparable and contribute directly to answering the research question. Inclusion criteria may include specific study design, so randomized controlled trials. So these are clinical trials, but it's randomized, meaning you put the patients into group A and B, but then it's random and it's in a controlled environment. But they're basically a type of clinical trial. And participants' characteristics, age, gender, and medical condition. And you have your intervention or exposure details, outcome of interest, and other relevant parameters. So if we go back to the PICO, it's pretty much the same. So P, population, would be this one. I, intervention, would be this one. And your comparison as well, it should be here too. And your outcomes of interest right here, except this time we need to consider the study designs. Okay, and we've gone through the study designs earlier as well. Alright, now exclusion criteria, it outlines the characteristics that disqualify studies from being included in the systematic review. Exclusion criteria help eliminate studies that do not align with the research question or that may introduce bias or confound the results, making it challenging to draw meaningful conclusions. This ensures the precision and focus of the systematic review. So for example, inadequate study design. So if we're looking at a research question on whether or not this dietary intervention is better for patients with type 2 diabetes, we would not want to look at narrative reviews, for example. We would want to look at clinical trials or cohort studies. So that would be this one. Insufficient sample size. How many patients in each study would you accept so that would be the number of patients in each study. So if you say, I want a minimum sample size of 10 patients, so if a study has 8 patients, then you do not include it. You have irrelevant interventions, so if you're looking at dietary interventions, you do not want to look at drug interventions. That would be excluded. Inappropriate comparators, so if you're comparing it to other dietary interventions, then you don't want to look at other drugs or placebo. Inadequate reporting of outcomes. So if we're looking at the HbA1c levels over the next 6 months, that information must be given in the study. If the study has all of your inclusion criteria, it's all good, but then they do not report the HbA1c levels, then you exclude it because it's not answering your research question. And studies with high risk of bias may also be excluded. We will go through how to assess bias in the later part as well. Okay, so now we have inclusion and exclusion criteria. Moving on to search strategy. Okay, now the thing is, I am aware that it's already an hour past our time, I think. I think we may need to have another meeting for this part. But if you guys have any questions, please let me know. I hope that was helpful because last time we went through the building research question fairly quickly, and some of you guys have told me that it's too advanced or it's going too quickly and you would like to ask more questions. So I thought if we went through it with a mock review with this document, it will really help you understand things better in a better perspective. So I think that was also a better idea because we went more in depth and you guys are asking really good questions. Okay, so I guess we can finish it here for today since it's been an hour. And we can do the next ones next time. Yeah, I think Saksham has told me that in the previous cohort he also had like 4 or 5 sessions. So this is only your second session and I think we're halfway through the slides, so that's good. We're on track. Okay, so 3 asked, by controlled environment we mean that, for example,